to indigo, otherwise known in the West as Baptisia australis, your false indigo, or Baptisia tinctoria, which is your wild indigo. In the East, the plant that is greatest in similarity is Isatis tinctoria, and that is actually woad, but it's comparable in its usage, and so you get some interesting compromise. So even though these are two separate plants, it's a great example of how these indigo-esque plants can be used medicinally. So in the West, Indigo Baptisia. Now, we're going to look at it here. Indigo is largely known for its, abilities to fight infection, especially respiratory infections when you're getting these high fevers. But it can also support liver health and is really important also for treating sepsis. So we're going to dive in a little bit to those topics. Indigo can be toxic. So this is another one of those plants where a little goes a long way. This is definitely not the case where more is exciting and better. No, use this plant respectfully and appropriately. In the West, among its properties, you've got astringent, anti-inflammatory, emetic, helping you to vomit, laxative. You can see how these particular properties, it has others, play into its capacity for supporting liver health. In the East, clearing heat and toxins. And toxins in the East includes viruses, bacteria, funguses, yeasts, molds, environmental, right? So it has a broader capacity. Even heat can become a toxin in the body when there's just too much of it. So this is going to be one of those that plays this way. Now, indigo's astringent properties are extraordinary, and it makes it incredibly useful for a wide variety of applications, but especially this idea of treating ulcerations, malignant ulcers, even mouth sores, especially when they're accompanied by like foul breath, loss of appetite, and general gastric disturbance, all signs of liver overacting, what we would say in traditional Chinese medicine as on the earth element on the stomach. So you get this kind of combination of indicators. Indigo tea can help promote the flow of bile. And of course, that helps digestion and is a part of the whole liver functioning. It can induce nausea and vomiting, especially without reducing, got that backwards, especially while helping to reduce a fever. So sometimes you get products that are going to cause vomiting and nausea, but they won't necessarily impact a fever one way or the other. Indigo's a nice 2-for-1. And for the conditions when it's important, such as sepsis, that's really a key feature. A 2-for-1. And of course, it's a laxative as well, as we mentioned, so that's going to help stimulate the bile. So all of this is helping to clear out what you don't want in the system that can be causing problems. It's a very active and efficient hepatic, and that means it's going to help stimulate the liver, cause increased biliary activity, and help move things along. And the American Indians used indigo roots as a vomiting agent to help, again, cleanse, laxative teas, to help prevent inflammation, to help treat aching teeth. The Mohegan tribe of New England cultivated the roots for a medicine to wash gaping wounds with. So you can feel how this is an important plant. These astringent and anti-inflammatory properties have, and clear toxins from the traditional Chinese medicine perspective, have important healing abilities. Now, its application with sepsis, it's just one of those, it's known for being especially effective. And there's many herbs can help treat this condition, but indigo's kind of like at the top of the pile in a certain sense for this. So let's get clear what we talk about when we mean sepsis. Sepsis is generally caused by infection, and it's a life-threatening condition, and it's when chemicals are released into the bloodstream in order to help fight, the immune system's kicking into gear and it's triggering inflammation throughout the body. But what can happen is that blood pressure starts to drop way too much. A person can start to go into shock. They can have spiking high fevers, confusion, this increased heart rate. All of those are signs of sepsis. And traditionally in a hospital setting, they're going to treat it with intravenous fluids, get you hydrated fast because the fluids are all a mess. You could almost say burning off. Antimicrobials could be included, vasosuppressors. Sepsis, when it's especially accompanied by dark or purplish discoloration of the skin and mucous membranes, that's the face is going to appear swollen, dusky, expressionless, as if it's been exposed to the cold for too long. This is really Indigo's big, great point. It's not considered the remedy for acute diseases characterized by great activity. This is when it's going into that kind of sepsis. Things are turning purple. You're looking cold, but it's fever going crazy and infection setting in. In case you're wondering how common this condition is in the United States, the stats indicate that pretty much one person is being diagnosed with sepsis every 20 seconds. And the risk of dying is increased 8% by every hour that goes by that you don't get treatment. So people kind of tend to stay home and wait. And you can't be waiting around with this. A virtual 10% increase in potential death is no small thing to be snubbing. People can be gone in as little as 12 hours if sepsis takes over. And again, skin is going to be pale, blotchy or blue. Lips and tongue could even start to look blue. The kidney is one of the first organs to shut down, further heightening the toxicity in the body. The blood pressure dropping, confusion in the mind, the lungs, the liver, all these systems, central nervous system, they're all going to start to get kicked in and impacted. Fast breathing, another big sign of it. So if you see someone who's been ill and they start to show these symptoms, you get them to a hospital ASAP. And absolutely, if you have Indigo at home, this is something that you'd want to be starting to consider administering. And it's going to be generally combined with a lot of other herbs, echinacea, especially for chronic viral conditions, chronic fatigue symptoms, adding myrrh to aid with the healing of infections and wounds, skin disorders. Disorders with the lymph are going to best be blended with cleavers and poke root, but you can feel how those conditions have not gotten to the sepsis level. Sepsis is serious, it's life-threatening. Get your body to the hospital where they have the equipment and the means immediately to come in and resuscitate and get a person back in balance. We do east and west here for a reason. Sometimes you don't have the time to be wasting on herbal products or applications that may not be at your fingertips. Pay attention to the signs. Visit our website at White Rabbit Institute of Healing to find out more about Indigo Baptisia and certainly the traditional Chinese medicine variety, woad, which is Isatis tinctoria. These are important healing plants. Very good, this plant, for, again, this feebleness, capillary feebleness, the turning the blue, the tendency to ulcerate. In the West, these would be called like a condition of atony. And it's a medical term that describes when the muscles just get weak, they're unable to contract properly. That includes the uterine, the uterus, the bladder, intestines. Those are all examples. So this is an important herb to know about, especially for these kinds of emergency situations.